Hello and welcome to Be Fit for Health. This is Bianca and we are here for another great show. Later on after this segment, we'll be talking with Dr. Krishanna Takemoto Gentile, and she'll be discussing a couple of topics on our health and our immune system and also about the COVID-19 and really what does that mean to our bodies and how can we protect ourselves. So it's kind of an important show. I want you guys to tune into that. So before I start, just to kind of reintroduce myself again, my background in the health industry has been about 30 years and, I've done it all. I've worked in gyms. I've worked in doctors' offices as a clinical therapist. I'm also currently a teacher for NCEP Fitness. And with that, I'm actually certifying personal trainers here in Hawaii. And that's my pleasure and it's my honor because right now I feel like at this point in 30 years, I'm passing the torch to the next generation and teaching them how to serve mankind and their people and their clients in the best possible way they can. My approach to health now is more holistic, more natural. I teach holistic nutrition as well to these trainers, the future trainers of our world. And I'm excited to be able to do that to facilitate my knowledge and everything that I've learned from the great mentors that I've had. So before I get into the next topic, which is your immune system, I talked a little bit about this last week. And a little bit more about it in the first show because, we are dealing with a issue out there and we're always dealing with actually something. We're surrounded by viruses and bacteria all the time. Our immune system is so strong and resilient. And you don't even know half the time if you're combating something because our body has a natural innate ability and intelligence to basically fight off any type of bacteria or infection that you may have. And that's the beauty of having a strong immune system. So this is why I'm constantly bringing up the idea of immune system. This is something we can control and something that we can do ourselves. And it doesn't have to cost a lot of money. Something as simple as moving for, 15 minutes a day or sleeping a good amount of time to let your body rest and reboot and get that energy back to do what it needs to do is simple enough, right? So I want you guys to remember you have control over your body to some degree. I mean, obviously, if you have any type of an ailment or pre-existing condition, an autoimmune disease or something like that, obviously it's going to be a little more of a challenge, but you have support with your doctors and your family, hopefully, and you'll be able to combat that as well. My hope is with the show is to be able to provide you with the information you need, empower you, and to give you the ability to make these decisions in an intelligent way for yourself. So moving along, I'm a geek. I like to do some research, and I go to these publications and journals, and I read a little bit about what's out there. So it's not just me saying what I think, even though I have some experience in my past. I'm not a doctor. I'm not a scientist. So I am going to give you some stats from some journals that I read. So the sleep and the immune system, what does that mean? So you're thinking, okay, I'll sleep. What's the big deal? But let me give you some science behind what happens when you're sleeping. So did you know that when you sleep, your brain shrinks? Now it doesn't mean that you become less intelligent. It actually does become a little smaller so that the cerebral fluid that's in your spine, the synovial fluid in your spine, goes up and down to your sacrum and up to your brain and basically re-nourishes your body. And it gives your brain nourishment as well. And it allows your brain to also detox. And that's kind of important to do because you want to get rid of any toxins that might be built up throughout the day from whatever it is that we do, whether it's thinking too much. I don't know if that's such a thing, but if you think too much or if you're stressing out, and stress we all know is not good for us. It has so many bad components to it. It definitely doesn't allow your immune system to stay strong. So stressing is not a good thing, but did you know that when you sleep and your brain shrinks a little bit and you're getting these fluids in your brain, it actually helps nourish your process of your during your sleep. It helps nourish your body and your brain. So if you don't sleep or don't sleep enough, you're missing this process. And this is necessary for us to stay healthy and for your brain to stay healthy as well. So the second thing too is that when the sun goes down, your body naturally wants to shut down. And the reason why it wants to shut down is so that it starts the repair process. It wants to start healing whatever it went through throughout the day. So all those free radical damages that we get, and believe me, we get a lot because our body makes about 300 sextillion a day. And if you think about that, that's more than a trillion. It's more than a billion. It's sextillion. So if you're trying to combat a free radical in your body and you're trying to get healthy, and you're trying to get, your immune boosted up, you have to take a lot of antioxidants, right? Well, here's a natural way of boosting your system. You go to sleep. And when your sun goes down and your body wants to go to sleep, usually about 2 or 3 hours after the sun goes down, your body typically wants to go into this mass repair phase. And so the suggestion from these experts is that if you can go to bed by 10 o'clock, from 10 to 2 is where all the mass repair is happening. So it's really important to get into a system, like a clock system, where from 10 to about maybe 5 or 6 a.m. is where the optimum level of sleep is. Because in different phases of sleep, you get different repairs of different organs. So it's really important to remember that sleep is medicine. It is. It really helps you repair the body. So just a little reminder that when you're sleeping, you're not stressed. Isn't that great? Unless you're having a nightmare, but that's a different story. But when you're sleeping and you're not stressed, what happens is that you're turning on the immune system and you're turning off the fight or flight. And that's important too, because fight or flight basically pauses the healing aspect of the body. Fight or flight program puts priority into the system because it thinks it's under some kind of emergency. So you want to turn that off, turn on the healing repair system, and sleep is one of those components that helps you do that. So the 3 case studies that I looked up, the first one was boost your T cell response. And this was done by a Journal of Experimental Medicine. And they say that sleep allows you to turn on the beta integrin, I can't pronounce it right, integrin, which is the docking sites of the cell. T cells dock on the cell, and it helps with the infected cell by killing the virus. So in order for the T cell to be able to dock onto the cell and give it aid and protect it from any type of viral infection, it has to be able to have those 8 areas turned on. And if you're stressed out, it doesn't get turned on. So that's why they say when you're stressing, try to shut down. Try to do something for maybe like a few minutes. Close your eyes, relax, try to relax the system, and then get back into whatever it is you were doing, because that allows your body to not go into this fight or flight program. Again, you want to protect yourself. So the idea is go to sleep, wake up with a better immunity, right? So the second case study, I'd say, is sleeping habits and susceptibility to the common cold. So they did a survey of 153 people, ages 21 to 55, and found that the people who slept 7 hours or more had 3 times more of the effectiveness of their immune system than people who didn't sleep. Now, that's kind of important, right? So that shows you right there. If you sleep and you are allowing your body to sleep for at least 7 hours to 9 hours at least, you actually have 3 more of a stronger immune system than someone who only sleeps 6 hours or less. So that's another important part. The third one is the effectiveness of sleep deprivation on the effectiveness of the flu vaccination. So they said that if you find that if you get an adequate amount of sleep, the flu vaccine is more effective in your body. It actually works for you better. So sleep, again, guys, sleep is medicine. Make sure you're getting enough sleep. Make sure you're taking the time to relax your system, and make sure you're rebooting your brain and giving it the right type of nourishment and detoxing the system and allowing those T cells to dock onto the cells in the way that it should to help combat any of those viruses. So just a little tidbit. I'm geeking out on you guys again, but I wanted to share that with you because I think this is priceless. It doesn't cost you anything to help boost your immune system with all the things that are going on out there. I thought this would be an easy way for you to at least take some control of your immune system. But we're going to take a really quick break, and when we come back, we'll be with the good doctor and go over some of her ideas on what to do.
Free month of Netflix, free month of Hulu, free month of Honolulu Club. What? That's right. Sign up today at Honolulu Club, Hawaii's premier athletic, social, and business networking club. And they'll give you the month of May for free. Honolulu Club offers state-of-the-art fitness services with Honolulu's top trainers and amenities. It's time to get ready to look your best this summer. Log on to honoluluclub.com or call 585-9626 for more info. Honolulu Club, Hawaii's premier athletic, social, and business networking club. Sign up today.
Hello, and we're back. And so, hope you guys got some rest. I know it's only a minute, but hey, listen, every little bit of rest makes a big difference in our body and the way that we deal with our day-to-day stresses. But speaking of some advice and some sound advice from an actual medical doctor, I'm bringing on today Dr. Krishanna Takemoto Gentile, and she is a family medicine doctor, and she's basically skilled with all different aspects of family practice. And I'm lucky enough that she had some time for me today to come on board and to talk to us about, what she's experienced, especially with what's going on today and our immune system and how to keep our bodies healthy. Doctor, are you on?
I am.
Oh,
Hi.
Yay. Hi. How are you?
I'm good. Thank you.
I'm so happy to have you on here. Thank you so much for giving me your time. I know, as a medical doctor, you're busy and you've got a lot of things going on. I just wanted to kind of see if there's any hope and advice and inspiration that you can share with us today regarding what we're going through today. Especially with your practice too and everything that you've seen. Any thoughts on what you think about the COVID-19 and our body's response?
Yeah, I mean, there's a lot of things to talk about. I would say probably one of the most important things is talking about how to prevent getting it, since that's what we're all attempting to avoid and really working on keeping all our patients healthy and our state healthy. So one of the biggest things I would say is right now staying home. And I just had this conversation with some of my staff that it's like really staying home, like not going to the supermarket 3 times a week for all different kinds of things. It's making a list and maybe going once a week, getting in there really, really quickly for the shortest period of time and then leaving. It's that's super important. And of course, we're all following the CDC recommendations for social distancing when we do go out. So I still have to go to the post office or whatever it is I have to do. And you want to be very aware of where you are and who's around in your surroundings. So if the store or the post office doesn't already have markers and like where to stand in line, you just want to make sure you're about 6 feet apart from another person, because that is super, super important in preventing transmission of this virus.
Well,
I
was going to say, just to that, idea of going out once a week. I mean, that's something that people probably don't even think about, something that's simple. I mean, you are thinking, okay, I went to Costco and I got all this food, and then, oh shoot, we're running low on our milk. I underestimated that 1 carton of milk was not going to be enough for the family. So let's go to the supermarket really quick and get another carton of milk. I mean, that doesn't make sense. Maybe, like you said, doing that one plan, that in itself is so valuable, doctor. That's something that I didn't even, I consider myself socially smart, but I didn't even think about that. So, that's a good point. And I wanted to just make that point out again. Going out once a week and making that plan is important. Please continue.
It's so important, and it really is changing what we're so used to doing. So it does take a lot of effort mentally to rework our habits. And when we do go out, another question I get a lot is, should I be wearing a mask? And I have sort of changed my tune over the past few weeks. First, I was telling patients no, and now I'm saying if you have one, go ahead and wear it. And it's really to protect yourself, protect your germs from going towards other people. It's not going to stop the virus from, attaching on to surfaces or anything like that. Or if you touch something, it's not going to prevent you from catching it if you touch something and then touch your eyes or nose. However, if you happen to sneeze or cough or whatever it is that's going on, if you're talking to someone and some spit flies out, at least that you will keep your germs to yourself. And so that can help. If you have a mask that's reusable, that's cotton, that someone's sewn for you, those are totally fine to use because, like I said, this is just to keep your germs to you. You want to reserve those medical-grade masks, like the N95 and all of that, for the healthcare providers in the hospital because those are the people who really, really need it. I mean, I don't even have one of those, and I'm a doctor, although I'm not in the hospital. So it's really reserving the resources for people who really need it and then, you can use like one that you sewed or that you have at home already. So I think that's another really important thing.
Well, I think what you said was such an important thing too, with you being a doctor and you not having one. You had to change the scope of your practice, correct? I mean, the way that you're seeing your patients because of that.
Oh, absolutely. We've converted all our face-to-face visits to virtual visits now, which basically means if you have a smartphone or a computer with a video, we're talking to patients over a video visit or a phone visit if you don't have a smart device. And it's nice that we can keep seeing our patients and talking to them and assessing them and still keeping everyone safe in their homes. So, if you're sick, I can still evaluate you. If you're healthy and you need refills in your diabetes medication, I can still do that. So it is, really shifting what we're all trained to do and how we're used to practicing to something totally new. However, at this point, it's whatever keeps patients the healthiest and keeps the doctors the healthiest.
Right. How about blood work, though? What if someone needs blood work for their, usual checkup? Are those things being postponed now, or because of all the labs trying to get the results for the COVID-19?
Yeah, I would say that if it's not an urgent test that has to be done right now, like if it's your yearly routine blood work, you should push those off. And we've pretty much done that with all my patients as well, just because you're right. The laboratories are really focusing all their resources to doing testing right now, and some of the lab sites have closed down. So, I mean, it's really just the resources have reallocated, and we want patients to stay home if they're healthy. So if it's like routine stuff, you can wait and do that later.
Would you say most doctors are now doing it like this, like the way you guys are handling your patients, or some of them closed up?
I think there's a range of what's happening out there. It depends on your healthcare system and how your practice is operating. I know that many physicians have transitioned to either telephone visits or video visits just for the safety of their staff and the safety of their patients. However, I've also heard that some practices have just completely shut down. So we want to keep open as long as we can, and I know most physicians want to stay open for their patients as long as they possibly can, because that's what we're all trained to do. However, it is a challenging time even for us to keep things moving.
Yeah, I can only imagine. I mean, and you guys are doctors for a reason. You want to help people, and you don't want to, not be able to take care of the patients that you've been taking care of for years. I mean, I'm sure there are some. I mean, my concern also is for those patients who have like actual high symptomatic issues like heart, or diabetics, or, people that may need more care. I don't know how long this will last. I mean, we don't have an idea, but it's a challenge for you doctors to be able to, really do that personal care the way that you're used to. This is all mechanical now.
It's a definite change in our paradigms of how we treat patients and how we do our visits, although I think most physicians are adjusting as quickly as we possibly can.
Well, I think I'm appreciative of any time that I get, so for me, it's just, especially when now people are panicking, right? And people are afraid. Every little bit of symptom, they're thinking, oh my God, am I going to die from this? Because there's so much panic, fear being brought over the media about what's going to happen to you. And, it's just most people are going to probably try to call you for little things, I'm sure. And I'm sure your office is trying to deal with that too.
Yeah. And that's part of what we do, when patients are concerned or anxious or worried about symptoms, which is totally normal right now. We want to be able to serve our patients and calm them down or reassure them or say, yes, you need to go get tested or no. And even just having that reassurance from your primary care doctor can really help reduce anxiety, which definitely can help to boost your immune system. So we would prefer that patients call their primary care doctor. I know we definitely do at my practice, and I feel like most family doctors, most primary care doctors would feel that way too.
So you agree that stress is basically going to deflate your immune system. It's not going to help any. So those panic attacks and those fear factoring of their mindset, whatever they're thinking, is basically altering their ability to boost their immune system, correct?
Absolutely. I mean, we know that added stress, mental stress, emotional, physical stress, even illness is a form of stress, can definitely affect the immune system in a negative way. And there are ways, although we don't really learn about this very well in medical school, there are ways to help to improve our thought process, to help lower stress. So one thing is meditation. That's always something that's been studied and that has been proven to boost your immune system, reduce your stress. It does a whole bunch of other great things for the body. And when I say that to patients, most people look at me and like, there's no way, like, I don't meditate. That's really hard. And
it's a skill. You have to learn it.
It really is. And I have a colleague who's he's a clinical psychologist, and he said it the best. He said, just tell patients that there's no right way to meditate. And I love this approach to it. So now I've switched that completely up, and I tell patients, you have a phone at home, set your timer for 1 to 2 minutes, and just put that timer on. And during that time, pick one point in the day for 1 to 2 minutes where you just breathe. You sit and breathe, and it's nice deep breaths in and out. And that is a form of meditation. Everyone can do that. We all know how to breathe. And so it's super, super simple. When people are home right now, they can do that really easily. Set your phone timer for 1 to 2 minutes and just take some nice, slow, deep breaths in and out. And that is a form of meditation. So you do get benefits even for something simple like that.
Isn't it funny people don't really realize that when you're stressing out, you actually hold your breath?
I know.
Yeah, and that is that totally is the contraindication on health benefits. You need to breathe to live, right? So, I noticed that too. I had a trainer who worked for me, and I have almost like an A-type personality. And every time he'd sit with me, he would be doing these deep cleansing breaths. Finally, I looked at him and I said, am I stressing you out? He's like, I'm trying to teach you to breathe. You're not breathing when you're talking. So your advice is well taken, Doctor. I agree with you. Those deep cleansing breaths make a big difference in the way that your body responds to whatever it is you're dealing with. But what else do you think helps with creating a naturally? I think you said meditation, but what about sleep? I was just geeking out on everybody a second ago about sleep and case studies on what sleep does.
Yeah, sleep is super, super important. There's lots of studies about the immune system and our circadian rhythms and what happens at night when we're sleeping. And the bottom line is that our immune system really boosts its capability for fighting things off during sleep. So getting good sleep at night is super, super important. Not only does it allow your immune system to produce the cell it needs to fight off colds, it actually helps to mature those cells overnight. So the baby immune cells become adult immune cells so that they can actually fight things off. And the opposite end, so if you're not getting good sleep or poor sleep, not only will it lower your immunity, so it makes you more susceptible for catching colds and viruses and infections, it also really affects your decision making. So a lot of people don't really maybe think of it this way, although as physicians and healthcare providers, nurses, we all know that there's studies that are done that as healthcare providers, doctors and nurses get less sleep, the amount of medical errors tends to increase.
Right.
And translating that to the general population, when we're sleep deprived going throughout our day, we're more likely to rub our eyes, touch our nose, touch a surface that probably isn't clean, and then touch one of our mucous membranes. And it's so unconscious. And when we're not awake and aware, we tend to do these things just without even thinking. So not only does it lower your immune system, it actually puts you at more risk for contracting the virus by accidentally touching something, touching your face, not washing your hands, maybe coughing without covering your mouth. So those accidents will happen more frequently too.
Well, that's interesting. I mean, I know there's so much more case studies out there or journals written on sleep and how powerful it is and the way our body responds to it on a positive level. But yeah, you're right. The lack of sleep, also the bad judgment, not making good decisions, and also on the cellular level, what your body is slowing down on response to, right? Like to the things that needs to be to respond to the negative stuff, getting rid of toxins and things like that too.
Absolutely.
But I was going to say with the washing of the hands, now there's a lot of hearsay out there with this virus, but they're saying that this particular virus, the COVID-19, the membrane outside of the virus itself is very weak, and that's why they're saying washing your hands vigorously for 20 seconds gets rid of the membrane, the outer part of that cell, outer part of that virus, and it eventually kills it. Obviously, I'm not a doctor, and I'm not a scientist, and I don't know this stuff particularly, but this is what I heard. How accurate does that sound to you?
I mean, washing hands is always effective in getting germs off, whether it's viral or bacterial or fungal. So that sounds correct to me, although, the research is so rapidly coming out every day. I feel like there's something new being put out there into the medical community, although hand washing is always a good idea. So the 20-second rule of hand washing really does effectively get rid of a lot of pathogens on your hands. And even for this virus, I think that is the most accurate and the safest thing to be doing right now. You can also use some of the alcohol-based hand sanitizer. Most of them have the grade of alcohol level that will kill things, and that's also effective. If you're out and about shopping that one day a week,
right.
you want to have some hand sanitizer with you so that you can wash your hands on the go too.
I don't have hand sanitizers, but what I bring along with me, which is really funny, is those Clorox wipes. I put it in a Ziploc bag,
yeah.
And I just, if I go somewhere and I just grab one of those guys and I either open doors with it or I just wipe things down or wipe my hands with it because there's nothing else in my car to do that just in case. So, I mean, that's what I'm doing.
That works too.
Clorox all the way. So what else do you think? What about the drinking of the water and getting, I know water flushes out things, but how much water do we really need at this point?
There's never a good data set on how much water each person's supposed to have from day to day. It seems to change every year. And the truth of the matter is it depends on where you live and how much you're exercising, how much you're sweating and all of that throughout the course of your day. However, I would say, at the bare minimum, you want to get 36 to 40 ounces a day, which for some people is like, oh, I do that all the time. And some patients, it's like, oh, my gosh, that would be a full-time job for me. And so...
Does sparkling water count?
Hit that... Does what?
Sparkling water?
Oh, yes. Yeah.
Okay, good.
Any water counts. We will count that.
Okay.
You want to have water both when you're healthy and especially when you feel like you're coming down with something. So a lot of people don't realize that, anytime you have a fever or you start to get some nasal congestion, that the water becomes super, super important to keep your body hydrated. Fevers tend to dehydrate bodies very quickly. And then any kind of mucus congestion, nasal congestion, if you don't have enough water, that mucus starts to get thicker and thicker. So actually hydrating helps to thin things out so that you can actually blow your nose or cough it up or whatever needs to happen.
Well, I think even with hot teas, that has water in it, but I would think that would be a good alternative too, just to keep the heat factor in there too, right?
Absolutely, yeah. Whatever helps people get water in, I'm all for.
Flavored, anything you want. What about our diets? What should we be consuming, especially if you are a little sick? Because obviously prior to you want to eat healthy, but when you are not feeling well, what are the best types of foods you think that we should be consuming as dietary goes? I'm not sure. I thought maybe vegetables would be great, but then people say warm foods. Yeah.
Yeah, so you're right. You're on the right track with the vegetables. I think something that's easy, especially because I know supermarkets don't have everything in stock all the time right now. If you can get some fresh fruits and vegetables, if that's possible, those all are really, really packed with good vitamins, especially vitamin C. So that's something that is always a good choice, and I can go into even more detail on that. Although kind of staying away from the really refined sugars, really kind of junk food, chips, the simple carbs. Those you kind of want to, not go too crazy on, which is always hard when you're home all day.
Right.
And
you're bored.
Picking the yeah, exactly. And then picking the healthy fats. So, things like the leaner meats, the healthy nuts, things like that. That's always a good choice. And then if you really want to get into it, so pretty much all fruits and veggies contain some amount of vitamin C. However, there's some that have even higher amounts of vitamin C. So, for example, cantaloupe or citrus fruits, like oranges and grapefruits, even kiwis, mango, papaya, pineapple, some of the berries like strawberries and raspberries and blueberries, even watermelon, those are really good fruits to kind of pick if you have that option, because there's really higher amounts of vitamin C in those. And same with some of the veggies. Some people don't even realize that vegetables have vitamin C in it. So like broccoli and Brussels sprouts, cauliflower, spinach, cabbage, other leafy greens, potatoes, sweet potatoes, tomato, winter squash, all of those things can also be really high vitamin C packed veggies. So those are really good options if you can pick and choose some of those. We know that vitamin C is helpful for making colds shorter and maybe even having milder symptoms if you do catch a cold. So that's an easy way to get it. And I know one of my patients told me they couldn't find any vitamin C for one of their kids. And I'm like, well, you can pick some of the foods. You should be able to find some of these foods.
And juice it if you have a juicer, too. They can juice it and get it more. Yeah.
Yeah. Just don't go too crazy with all the fruits in the juice. But yes.
Natural sugar overload. That's all good.
Yeah. And then some other foods to consider are foods that are packed with zinc. So zinc is another trace mineral that helps to boost the immune system. We know that patients who take some amounts of zinc, not even that much, some amounts of zinc daily tend to be less likely to catch common colds. And then if they start some zinc right as soon as they feel like they're coming down with something, that can also decrease the duration of a common cold or illness or a virus. So there are some foods that are high in zinc as well. So a lot of the proteins out there, like mostly the animal proteins, those tend to be high in zinc. And then if you're vegetarian, you can look at nuts or whole grains or legumes. Even some of like the nutritional yeast can have some zinc in it. So that's another good food group to kind of be looking at to get your zinc in.
Well, that's really good information, because every time you get sick, you always partner up zinc with vitamin C. But then another one that I think people don't underestimate is vitamin D3. That they say that a little bit higher dosage of the vitamin D3 for a shorter period of time helps with combating viral infections as well. Is that true?
Yeah, absolutely. A lot of people know vitamin D helps with bone growth and maintaining bone strength. However, they don't realize it also helps to boost your immune system. So I agree, it's really hard to find vitamin D in any food source. It really is made by our skin when we're out in the sun, which in Hawaii, that's not really something you want to do without having sunscreen on or covered up.
But doesn't that also block vitamin D coming into your skin when you wear the sunscreen? Not to say that not to do that, but like, and there's a certain time of the day too that it's the best time to get the vitamin D. Isn't that correct as well?
Right. Yeah. So, the sunscreen and the SPF rash guards or things like that will block the production of vitamin D with your skin. However, they protect you from skin cancer, which is really important.
Which is kind of important.
So, yeah. So the trade-off is sometimes it's better just to take the vitamin D in the supplement form. And you're right, D3 is the most active form of vitamin D. Now, it's one of the few fat-soluble vitamins out there, so you actually can overdose on vitamin D. So no matter what, with all the vitamins, you always want to talk to your primary care doctor, because things interact with other medications. You can take too much. You can get some side effects. So you always want to talk to your primary care doctor before you start on it. However, a little higher dose than the recommended daily allowance, which is somewhere between 600 and 800 is the recommended daily allowance. So usually I have my patients take a little higher dose for certain periods of time. And, of course, I'm monitoring them. So It's safe to do.
Right. Because I know there are some illnesses out there that deplete the vitamin D in the body. So, you don't want to have your numbers too low because it can cause other side effects too. So keeping up with your vitamin D is important, not only just for your immune system, but also for your health.
Absolutely.
So when it comes to, besides supplementation, what other factors? I mean, in one of my shows, the first show that I ever did, I talked about having a positive attitude is key to the way your body responds to stress. What do you say about that?
I really believe that the mind-body connection is very, very strong, and especially when it comes to the immune system. So having a positive attitude really makes a difference. And is a small emerging field of medicine, very small, where practitioners look at immunology and psychology and the neuroimmunology and all of the interplay with everything, with all those cells. And there's definitely some data out there that what we think and how we are, and, we look at the sleep and all of that sort of thing can affect our immune system. So positive attitude definitely makes a difference.
Yeah, because there was a science, some kind of a journal written out there when it came to a study in Cincinnati where they said, visualization and your brain doesn't know the difference between if you're actually being chased by a bear or if you're thinking that you're being chased by a bear type of thing. Your body believes what you're thinking because it doesn't see outside of itself, right? Only your eyes see it, but your cells don't see what's happening outside of your body. So if you're thinking it, it's believing what your thoughts are. So it responds in terms of what your thoughts, what your true belief system is. So, they did the study where they had two groups work. One group worked out with weights, and the other one just basically visualized for 3 months that they were working out. And the surprising result was that obviously the people that worked out got some kind of gains when it came to muscle tone, but the surprising result was that 10% increase in muscle tone for the group that was just thinking about working out, like visualization, those exercises they did every day, all day, throughout the day, just to keep their body in health. So it was really interesting to see this study. This was just one study that I read, but there was other people that talk about your thoughts are, can become reality. And if you're thinking, I'm healthy, I'm healthy, I'm healthy, I'm fine, I'm fine, I'm fine, eventually your body will start to believe you because it is a subconscious belief system, right?
Absolutely, yes. And our cells don't differentiate between what we're thinking and what we're seeing. So you're right. And I'm healthy, I'm healthy, I'm healthy is a really great affirmation to say every day, especially right now. Anytime you feel like you have a sniffle or anything like that, a lot of us will go into the, oh no, I'm sick, I'm getting sick.
Right.
And rather than saying that over and over in your head, just switch it to I'm healthy, I'm healthy, I'm healthy. And you're right, you can, to a certain degree, trick your body into thinking that you're healthy.
Isn't it amazing how we're like a computer? We get programmed to start believing certain things, and it could be cultural, it could be just environmental. And, I look at certain types of people that have come across my world, and some people are just absolutely positive no matter what, and they just seem to have it easy, it seems like. And it seems to me that we get in our own way when it comes to our health and well-being, because of the belief system that we may have been brought up with. And, I think you're onto something with the mind-body connection thing. It's imperative that we keep, especially what's going on outside with this COVID-19, and we're listening to the news. Maybe we should turn the TV off once in a while. I mean, yeah, we should keep up with what's going on, but just kind of get in with our family, maybe have some good times, laugh a little bit more and enjoy ourselves so that our body doesn't get so stuck in this we're going to die phase.
Absolutely. I've had a lot of patients tell me that they've stopped watching the news all day, that they're home, and it's reduced their stress level. And I totally believe it. You hear the same thing over and over again about how bad this virus is and everything, and it does make you feel, at least makes me feel more stressed.
Yeah, because you have no control.
Really,
what are you going to do?
Yeah. Yeah,
so,
that's a really smart thing to do.
How are you going to, moving forward? I guess the question is, we're mandated to be, stay home till the end of this month. So are you going to just continue with the practice that you've been doing, which is the video meetings and things like that? Or when do you think your office will open up more to the traditional? Are you guys going to wait till the end of the month as well? What's your guys' plan?
Yeah, we're taking it day by day, although right now we are definitely doing all virtual visits or phone visits unless we absolutely have to see a patient face-to-face, just to keep our patients healthy, keep my staff healthy. Even between me and the other physician I practice with, we're operating in different parts of the practice and the office so that we can social distance. So we're really working on following the guidelines of the CDC in our state and keeping our staff, ourselves, our patients healthy. And hopefully, we'll have to reevaluate and see where all this goes. Hopefully, if people are really staying home right now, the virus will run its course quicker, and it'll all depend on how well we're social distancing at the moment.
Well, it's a shame, too, because I know that your office you guys aren't just a medical facility. You guys also have like a lab in there, too, right, where you guys were able to draw blood from, for your patients there, and you had a full facility. You have a facility that houses many different aspects of your practice. You guys are able to service your patients in a way that a lot of other doctor offices aren't able to. So it's a shame that you have to go to this, level of practice right now.
Yeah, absolutely. It's a real big adjustment. And we still are, if we need to bring someone in to get blood drawn, we stagger it, and it's just a whole different process now. Everything has to be very calculated, and how many patients are coming in and if they're even coming in. So it's a big adjustment. So we're looking forward to life back to normal, as most people are. And at the moment we're keeping people safe as much as we possibly can.
Well, do you have any any last thoughts to, our health and our well-being? If there's anything else that you can suggest to, the people of Hawaii of what else we can do at home as far as staying healthy, with our families.
I would say control the things you can control, as far as, what you're eating and what you're thinking and how much you're sleeping, and how much water you're drinking. And then, the things that are out of your control, don't let it get to you. Even if you have, if you have a little garden or someplace outside where you can be safely, I would highly encourage that right now. And if you have questions or concerns, call your primary care provider, because that's what we're all here for right now, is to support you, our patients, and our state in getting through this.
So if somebody wants to contact you, how can they reach you?
Our office number is the best way to reach us. We do have a website too. However, our office number is our best contact place, and I can give it to you, or I don't know if you want to say it.
No, you're welcome to say it, please. You know it better than I do.
Yeah. Our office number is area code 808-955-1544. And we also have a website that is www.doctor, spelled out, doctorctg.com. So either one of those ways are the best ways to get in contact with us.
And your scope of practice is family medicine, or is there anything else that you guys are able to take care of in your office?
Yeah, so it's myself and my father. We're the two physicians who practice together. We're both family doctors, so we see all ages, from birth all the way up to the elderly population. I still do some women's health. However, I don't deliver babies anymore, and I don't do prenatal care.
Okay.
And then we also do some alternative medicine. So we do some nutritional medicine, alternative medicine, and my father specializes in geriatric medicine as well.
Oh, wow.
And so, yeah, so we got a pretty big scope of practice here.
That's what I'm saying. That's why I'm saying it's sad because you guys have to resort to the more mechanical way of taking care of your patients versus a person to person, because I think your office is really a unique place to get taken care of. And, I'm looking forward to the day that I can walk into your office and say, yay, you guys are back to normal again.
Yes, we're looking forward to that as well.
What I'd like to do, if we can, Doctor, is to bring you back on maybe in the near future, and we can maybe go over women's health, if that's okay with you, because I think there's a topic that, women are going through menopause, and a lot of them don't know what to do.
Yeah, absolutely. I think that's another really great, large topic.
It's huge. I know. This could be a series because, let me tell you, I know a lot of women out there who are, around my age where we're pre-menopause and women who are going through it. They're like, what do we do to get these symptoms to go away? Some of them gain weight. Some of them are just feeling horrible. So I look forward to that. And I appreciate you being open to coming back to do so.
Yeah, absolutely.
So we're going to be taking a break soon, but before I go, thank you, Doctor, for taking the time and giving me your time. And, I wish you all the best. Please be safe and stay healthy. And I look forward to speaking with you very soon.
Thank you so much for having me.
No worries. Have a great day.
You too.
We'll be right back, guys.
Free month of Netflix, free month of Hulu, free month of Honolulu Club. What? That's right. Sign up today at Honolulu Club, Hawaii's premier athletic, social, and business networking club. And they'll give you the month of May for free. Honolulu Club offers state-of-the-art fitness services with Honolulu's top trainers and amenities. It's time to get ready to look your best this summer. Log on to honoluluclub.com or call 585-9626 for more info. Honolulu Club, Hawaii's premier athletic, social, and business networking club. Sign up today.
And we're back. Thank you, everyone. I just wanted to say, you guys are taking some time off in your weekend to be with me, and I appreciate that. And I wanted to thank the doctor again for Dr. Krishanna Takemoto Gentile for coming on and talking to us about, her perspective on the virus and our immune system. I also appreciate her validating some of the things that I've been saying on the show regarding your immune system. So it's good to know what we can do. And she's right. We can only control what we can control, and the rest, just leave it up to circumstance, and we'll deal with it when we have to. That's the most important thing. I just want to touch up on another factor of the immune system. If I can geek out on you guys a little bit more, that would be great, because we have a few minutes before we're done here, and I wanted to kind of talk to you about, so when you think about fasting, what do you think about? You think about not eating, right? Well, technically, yes. And there are some fastings where you can eat a certain amount of calories, like maybe 500 calories in a day. There's some fasting where you juice. The fasting that I'm talking about, that actually really there's science behind it. And there's a lot of medical journals written on this about what water fasting does for your body. And that means no chewing gum, no bone broth, no juicing, no vegetables, no food, just water. So what that typically looks like is, if you know what intermittent fasting is, that's another good fasting, is that you stop eating, let's say at 8 o'clock. You drink water, obviously, but you go to bed, you wake up, you don't have breakfast. You can have black coffee, no sweetener, nothing like that. At about 12 or 1 o'clock in the afternoon, it's about 16 hours, you are basically allowed to have your first meal then. And in this process of time, I'm going to tell you guys what happens to your body. And that's the beauty. That's where all the magic happens. So when you're fasting and just water fasting, the longer you can go, the better it is for your body and your immune system. And this isn't me saying this. This is all journals, people's doctors talking about this, experts telling you exactly what happens. So I went ahead and did a timeline. And in this timeline, it tells you exactly what your body does. So when you eat, your body goes into this digestive phase, right? The last thing it wants to do is boost your immune system. It's trying to break down the food so that your body assimilates it and absorbs it. So when you're not eating, guess what? your body goes on vacation. It goes, okay, we don't have to worry about digesting. Now let's take a look at the body and see what's happening. Is it healthy? There are some areas that needs to be repaired. This is what your body does. So on hour 12, it takes about that much time. On the 12th hour, your body produces and kicks in growth hormone. Now, as we age up until the age of 30, your body doesn't produces a lot, but after 30, it starts to slow it down because it doesn't feel like it needs it as much. And growth hormone is like your anti-aging hormone. This is where you stay lean. This is where you have lots of muscle and you look good. Your skin looks good, all that good stuff. So your body actually kicks this up at 12th hour. At about the 13th to 15th hour, your body starts burning energy from ketones. I don't know if you guys understand what ketones are. Your ketones are produced in your liver. So basically, ketones works with fat fueling. So that's why ketogenic diet. I don't know if you guys can relate that name to the ketones, but ketogenic diet is fat. You consume good fats, not bad fats. And your ketones work with that to basically produce energy as well as helps with boosting your immune system by boosting the T cells. So ketones actually help support the T cells in your body. So that's really important. Another thing that happens when you're in your fasting at about the 17th hour, this is where I love my fasting. I think I got up to 22 hours. I'm not quite up at 24 hours yet, but you develop a fasting goes into autophagy. Your cells basically self-detox. So what happens is your cells realize, okay, we're not getting any glucose, we're not getting any food, so let's start looking for food elsewhere. So it starts looking for the free radicals that are in the cells. It eats that up. It eats up the dead cells and gets rid of it. So it's like it's like house cleaning. You know, you're cleaning all the clutter. You're getting rid of things that you don't need anymore. That's what the cells are doing. And that's really good for your body because it gets rid of things that it doesn't need anymore. And that goes on till however long you're fasting till. At the 24th hour, this is the beauty. This is where I need to get to, is that your stem cell production gets kicked up. So 3 major organs start to repair itself at this point. In the 24th hour, your intestinal stem cells get kicked up. So basically starts repairing leaky gut, SIBO, IBS issues start to go down. Your also inflammation starts going down. Serotonin levels start going up, which is your feel-good, makes you happy neurotransmitter. And then your BDNF, which is a part of your brain fertilizer. It helps to feed the brain. So in 24 hours, you're getting all this good stuff. And also, the last but not least, your inflammation starts to go down. So your CRP starts to go down. Your blood pressure starts to go down. So in 24 hours of fasting, your body is repairing a lot. So think of it in those terms. So when you get sick too, sometimes you also lose your appetite. Think about what your body's doing. It's kind of telling you to stop eating because it needs to start focusing on repairing and healing itself because it can't focus on the digestive part of it. It needs to focus on repair. So sometimes when you lose your appetite, it could be just because of that. And think of it in terms of also that when your body tells you something, maybe you should listen to it. You're not going to die from not eating for one day. Trust me. And so look up these different fasts, intermittent fasting, 24-hour fasting, there's 36 to 48-hour fasting. And the longer you go, there's other additional benefits to it. I usually don't, when you're going to fast something longer than 24 hours, I would recommend talking to your doctor just because we don't know what's going on with your body yet. I'm not your doctor, so I don't know. So I'm just giving you information again. Please do your homework. There's a lot of journals written out there. You can go to PubMed.gov. You can go to ScienceDaily.com. There's all these other search engines you can go to get information. You guys are welcome to reach out to me at BeFitForHealth.com. BeFit4, the number 4, not F-O-R, BeFitForHealth.com. You can reach out to me in Fit for Health on Facebook and B.FitForHealth on Instagram. Either one of those, I will respond to you. You can also go to my YouTube. I have a YouTube, BeFitForHealth. And I have a lot of videos on there about things like this. So you guys can watch that. And if you need to make a comment and subscribe. So guys, we got control, right? We're empowered. We know what we're doing. We have information. And I will continue to bring you guys more information as the weeks go on. I wish you all the best. Stay healthy, stay safe, stay home for now. God bless you all. And aloha.